Welcome. Have you ever heard of autoimmune cranial neuropathy? It's a rare and fascinating condition where your body's own immune system mistakenly attacks the cranial nerves. These nerves are essential because they directly emerge from the brain and brainstem, controlling vital functions like sight, hearing, facial movements, and even swallowing. Join us as we delve into the intricacies of this complex disease, exploring its causes, symptoms, diagnosis, and treatment. So, what exactly causes autoimmune cranial neuropathy? The short answer is, we don't fully know in every case. It's classified as an autoimmune disorder, meaning the body's immune system, which normally protects against foreign invaders, mistakenly targets its own tissues, in this case, the cranial nerves. The reasons behind this immune system malfunction are often elusive, but some researchers believe it could be triggered by viral infections, underlying systemic autoimmune diseases such as lupus or rheumatoid arthritis, or, in rare instances, even certain medications. Sometimes, no specific trigger can be identified, making the diagnosis and understanding of the condition even more challenging. To understand autoimmune cranial neuropathy, we need to explore its pathophysiology. The immune system's attack on the cranial nerves leads to inflammation and damage. This damage can disrupt the nerve's ability to transmit signals effectively. Picture it like a frayed wire. The signal gets weaker and more distorted. This disruption can cause a wide range of symptoms depending on which cranial nerves are affected. The inflammation can also compress the nerves within the skull, further exacerbating the problem. The specific mechanism of the immune attack can vary, involving antibodies attacking the nerve directly, or immune cells infiltrating and damaging the nerve tissue. Autoimmune cranial neuropathy is considered a rare condition. Precise epidemiological data is scarce because it's often underdiagnosed or misdiagnosed. It can occur in people of all ages, but some reports suggest a slightly higher prevalence in middle-aged adults. Because it can be associated with systemic autoimmune diseases, individuals with those conditions might have a higher risk. The lack of large-scale studies makes it difficult to determine the true incidence and prevalence of this disease accurately. The signs and symptoms of autoimmune cranial neuropathy are highly variable and depend on which cranial nerves are affected. Commonly, patients may experience double vision due to problems with the nerves controlling eye movements. Facial weakness or paralysis, similar to Bell's palsy, can occur if the facial nerve is involved. Other potential symptoms include hearing loss, tinnitus or ringing in the ears, vertigo or dizziness, difficulty swallowing, changes in taste, and even problems with speech. Pain around the face, head, or neck is also a common complaint. The symptoms can develop suddenly or gradually over time and may fluctuate in severity. Diagnosing autoimmune cranial neuropathy can be challenging, as many other conditions can mimic its symptoms. The diagnostic process typically involves a thorough neurological examination, including assessment of cranial nerve function. MRI scans of the brain and cranial nerves are crucial to rule out other causes, such as tumors or infections. Blood tests are essential to look for markers of inflammation and to identify any underlying systemic autoimmune diseases. A lumbar puncture, also known as a spinal tap, may be performed to analyze the cerebrospinal fluid, searching for signs of inflammation or abnormal antibodies. Nerve conduction studies and electromyography, EMG, can help assess the function of the affected cranial nerves. The diagnosis is often made by excluding other possibilities and considering the patient's clinical presentation, imaging, and lab results. While autoimmune cranial neuropathy isn't typically divided into rigidly defined types, the presentation varies depending on which cranial nerves are affected. Some individuals may experience isolated involvement of a single cranial nerve, while others may have multiple cranial nerves affected simultaneously or sequentially. The specific pattern of cranial nerve involvement can sometimes provide clues about the underlying cause or the severity of the disease. It's important to remember that each case is unique, and the clinical picture can be quite diverse. The primary goal of treatment is to suppress the immune system and reduce inflammation. Corticosteroids, such as prednisone, are often the first-line treatment. These medications can effectively reduce inflammation, but can also have significant side effects with long-term use. Immunosuppressant drugs, like methotrexate, azathioprine, or cyclophosphamide, may be used to further suppress the immune system, especially in patients who don't respond well to corticosteroids or who experience unacceptable side effects. In some cases, intravenous immunoglobulin (IVIG) or plasma exchange may be used to remove harmful antibodies from the bloodstream. Supportive care, such as physical therapy, occupational therapy, and speech therapy, can help patients manage their symptoms and improve their quality of life. Pain management is also an important aspect of treatment. Unfortunately, there are no proven methods to directly prevent autoimmune cranial neuropathy. However, maintaining a healthy lifestyle, Managing underlying autoimmune conditions and avoiding known triggers, such as certain infections, may help reduce the risk. Prompt diagnosis and treatment of any systemic autoimmune disease can also potentially minimize the likelihood of developing secondary autoimmune complications, including cranial neuropathies. Because the exact cause remains largely unknown, preventative strategies are limited. The prognosis for autoimmune cranial neuropathy varies depending on the severity of the disease, the specific cranial nerves involved, and the response to treatment. Some individuals experience complete recovery with treatment, while others may have persistent symptoms or relapses. Early diagnosis and aggressive treatment are crucial for improving outcomes. Recent research has focused on identifying specific autoantibodies that target cranial nerves, which could lead to more targeted and effective therapies. Additionally, clinical trials are exploring the use of newer immunosuppressant drugs and biologic agents in the treatment of this condition. Further research is needed to better understand the underlying mechanisms of autoimmune cranial neuropathy and to develop more effective treatment strategies.